Hi, this is QD Clinic. I'm Jack Cush with Room Now. QD Clinic is brought to you by Room Now Live. We need experts like you. Go to roomnow.live and register. Yesterday's case that I'm going to talk about today is the differential diagnosis of Tenosynovitis. All right, think about it. What's the differential diagnosis of Tenosynovitis? You must know this. Surely you've got 1, 2, 3. Are you kind of stuck at 3? Is there a 4th, 9th, and 12th? Well, let me tell you my story, and maybe you'll help me with this diagnosis. 70-year-old, kind of light skin, dark skin person, or a light shade of dark skin person, male, says he's from Ethiopia. I believe him. And he has been in this country for a number of years, and he presents with a 3-month history of left shoulder, left elbow, left wrist pain. That's it. He says it's kind of sore, and he kind of points the whole arm, but it's mainly up here and mainly when he uses it. And I'm thinking, gee, if it was bilateral, 7 years old, I'd be thinking PMR. Except it's unilateral, and he denies anything with the right shoulder. Plus, he's not white, and when you're not white, my possibility of having PMR goes way down. It's possible. I know you all think you know someone, but this is a white person's disease, right? But anyway, he's got this unilateral pain, shoulder, elbow, wrist, and he's unclear about swelling or redness, denies fever, denies morning stiffness. There goes PMR. Denies any trauma, denies any recent infections, hospitalizations, other medical problems. He has been on atorvastatin for 11 months, and his cholesterol is well controlled. He has really nothing else about him that is important. Again, he denies any swelling. He denies any real stiffness. He says that he doesn't take medicine for this because the problem is sort of not so bad on some days, but worse on other days, and worse when he uses it. So what happened here? About 6 weeks ago, he went to his family doctor. Same complaints. The family doctor gave him a brief trial of amitriptyline, 10 milligrams. I don't know what that was about. Gave him 5 milligrams of prednisone for 7 days. He says he got much better on that, but he completed the 7 days and never restarted it. Did he get completely better? He doesn't really know. And then gave him a prescription for naproxen 500 BID, and he only takes that like twice a week, 1 pill. So it's really hard to say what the therapeutic response to any of these medicines has been. When you examine him, this is where it gets interesting. All other joints are normal. The right side, the lower extremities, spine, neck, etc. His exam is normal. Eyes, lungs, chest, belly, skin. The left upper extremity, not so normal. Shoulder has normal range of motion, no pain when I palpate the glenohumeral joint. Elbow, no contracture, no swelling, no pain. Not on the epicondyle, not within the articular groove. The wrist, now the story changes. Because so far, the guy's looking like a crackpot with nothing but, guess what? The wrist is swollen. And in fact, I'm pretty certain, without having imaging or an ultrasound, that this is largely tenosynovial swelling. You know how you prove that? You have swelling over the dorsum of the wrist, and when you move the wrist, you get pain. And if you keep the wrist stable and straight, but then flex at the MCPs forcibly to put stretch over the tenosynovium or over the tendon sheaths, and you get pain, that's what happened with him. So, and the tenosynovial swelling is not the kind with Dacre veins. It's not the abductor pollicis longus or the extensor pollicis brevis that does this. He had a negative Finkelstein's maneuver. But isolated, non-warm swelling. And it's clear. It's 1+. It's not trace here. He doesn't really notice it. When I say, look at this arm, he doesn't really notice it. Going on 3 months. What's the differential diagnosis? I wrote down a few things, and then I came home after work. Before I did this, I did a literature search, and my differential was pretty much spot on with a few exceptions. But I'm happy with what happened. What's high on the list? I'd like to put PMR on the list, but it's unilateral. PMR can give you tenosynovitis, but again, he has no PMR diagnosis, so even unilateral tenosynovitis doesn't really work here. Could this be RA? A very odd presentation of RA? Yes, it could, and probably should test for that. But it certainly would be an odd presentation. You could say he has an oligoarticular arthralgia and maybe one swollen joint. Would the differential diagnosis therefore not be infection? Maybe even psoriatic arthritis, but no evidence of psoriasis here, no family history psoriasis. Nails look good, scalp looks good. But could he, oligoarticular, same as monoarticular, could this be an infection? Well, okay, what are the infections that give you tenosynovitis? Well, there's GC, not likely here. There's hepatitis B and C. There's a range of infections. There's acute rheumatic fever. There's TB. He's from Ethiopia. He denies any history of TB. There are a number of fungal infections that could do this, strange and atypical mycobacteria, what we now call non-tuberculous mycobacteria, but also chikungunya. I've had another patient from Ethiopia who had chikungunya as a form of polyarthritis. So, but also high on my list is CPPD. Not gout, but CPPD can do this. Doesn't usually present as pseudo-gout attacks, but it can present as a chronic tenosynovitis. And then lastly, drug-induced. And high on the list, well, any of the drugs that can cause tendinopathy could do this, and that would, I guess, include the floxins and whatnot. But I think that what I found out in my research was aromatase inhibitors can do this. And the other drugs are, yes, that's right, statins. He's on a statin. So my plan with this gentleman was to, number one, tell him he's got to take something every day and come back to me on drug. Second, I told him to take prednisone 10 a day for 2 weeks, stop the statin today, come in, do a drive-by, let me look at the wrist. And when he's totally normal, it can help me with what I'm going to do in the future, okay? And then after he's done with the steroids, he can take 1 naproxen a day, and we'll see how that does when he comes back in 6 weeks. This is a free clinic, meaning these folks don't have insurance, nor do they have money, so testing goes on in stages. So I did a CBC, CMP, Cedrate, CRP, Hep B, Hep C, RF, and CCP. He said he could afford that. I think our discounted prices, that was about $110. Now, there's more I'd like to do. It's doing ANCAs and B27s and get crazy, but I think my next round, if he still has symptoms after steroids and stopping the statin, I'm going to do a quantiferon. I'm going to do an RPR, a uric acid, an SPEP, what else? A chikungunya serology, probably get x-rays, chest x-ray, and x-ray of the hand and shoulder. Might have to do that in stages because, again, this is all cash business for those who don't have any cash. Interesting case, don't you think? We'll talk tomorrow. Bye.